Hi, and welcome to Tapinto Hudson. I'm Steve Lenox, and I'm the publisher of Tapinto Bayonne, Tapinto Hoboken, and Tapinto Jersey City. Every week since we've started the show back in October, we've talked about the big issue at hand, and that's, of course, COVID-19. The number of cases, what we're doing to fight it, what we can all do together to stay healthy. And there's nobody better to talk about where we stand now with COVID-19 than Stacy Flanagan. Stacy, of course, is the Director of Health and Human Services for the City of Jersey City. And Stacy, we're so glad to have you here today.
Thank you for having me.
So Stacy, let's go back 15, 16 months, January, February of 2019. None of us knew what was coming in terms of COVID-19. I assume there was a little bit of preparation going on your side, and then you hit the ground running come March. And in many ways, Jersey City really took a lead on the fighting of this pandemic.
Well, I will say that obviously in 2019, we had a team at the Office of Emergency Management. I don't really do anything alone, but my coworker, Director Greg Kearse, and I started talking about supplies and PPE and concerns of respiratory illness. January 2020, took my nice vacation I usually do in the beginning of the year. And as soon as I hit ground, I got my first text saying it was our first person under investigation. That was January 26th. From there until March 6th, we had been daily kind of taking a look at testing numbers, trying to get supplies in. Our first case was March 6th with one individual in downtown Jersey City who worked around town. And so we were really concerned of the footprint. Mm-hmm. Fast forward to, yesterday's numbers. We were just under 30,000 individuals having tested positive, with nearly around 800 fatalities from the disease. We're still watching hospitalizations, but much lower than it's ever been. And we are just at the brink of 70% of the cities, at least one vaccine.
That's great. And Stacy, I assume you've got to credit, you look back on that March 6th date when that first positive test came through, and you look to where we are now, you've got to look at that preparation that you and Director Kearse did.
I don't know if I can remember.
And of course, the leadership of Mayor Fulop, press conference after press conference after press conference. And I don't want to say you were behind him at every one, because you were standing right there next to him at most of these press conferences. So, just talk to us more about that preparation that went on over those couple weeks and in the first few weeks of March.
Yeah, I will say, pretty much daily, we had a team of myself, our health officer, Office of Emergency Management, JCPD, FD. These were our first responders. Those were our priority and our concern. That was really the first thing we did, was get the proper PPE into the first responders. Mm-hmm. And so by the time we started seeing some fatalities through ambulance and such, we were able to have the proper equipment to those individuals. The mayor was really supportive, and we looked at any resource, every resource, and obviously praising the work that Councilman Michael Youn did prior to his passing. He was focused primarily on this, really looking to break down every barrier in the city to support us, and we put a lot of resources towards this work. We spent $7.5 million on just testing, organizing testing, staffing for testing, and that was just last year. So in 2021, we, got that money back through all of the federal resources. But prior to there being federal resources, we said we need to do something. We had the council behind us, obviously. My boss, has been at the forefront of this, really saying, what else can we do? What do we close? How do we close it? How do we open? How do we reignite the economy? Where do we support individuals? So everything from getting PPE to our hairdressers and our restaurant owners to then the dollars that followed. And now we're looking at all the human services side. So it's sort of the unique pitch of Health and Human Services is we just focused on this pandemic from a real deliberate health side, but this health side was not the only thing. The human service component of serving our veterans, serving our seniors, serving our immigrant populations, those people that are stuck in their homes due to domestic violence, things like that were coming up as human service concerns, we were also able to address right there, kind of at the same time.
And these are all items we're going to talk about in the next couple of seconds. Before we wrap up this segment, though, you mentioned Councilman Yoon, and of course we honor him almost every week on this show. And just Saturday, there was another vaccination clinic out in front of his old headquarters there on Central Avenue. But what is your message as we wrap up this segment to the folks that still haven't gotten vaccinated in Jersey City?
Getting vaccinated is the most important part of kind of getting back to a level of normalcy in our community.
Thank you so much. Stacy, we're going to come back. We're going to talk more about the fight against COVID-19, what we're doing now, how we're going to stop the spread from coming again, and the many other issues that your office works on. Thank you so much for being with us.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
At Hudson Regional Hospital, we promise to be prepared for your emergency.
We promise to provide world-class robotic surgical care.
We promise to treat you like family.
To provide accurate diagnostic care.
To provide the most innovative orthopedic care at your doorsteps.
We promise to treat your baby like our own.
To never stop investing in the best of spinal care.
To be with you every step of the way.
Here at Hudson Regional Hospital, we promise to take care of our community.
Hi, and welcome back to Tapped into Hudson for our second segment with Stacy Flanagan. I don't want to do a long introduction because I want to get right back to it, Stacy. We talked in the first segment about the prevention and what happened in January, February, March, and even before that. Now we're 15, 16 months into this. We're down to a handful of cases. The deaths, thankfully, are starting to, end,
Yeah, I think in June we've only had one fatality.
That's great.
And 176 cases as of yesterday.
But in saying all that, COVID-19 certainly isn't gone. It's still out there in the community. We're still dealing with these different variants that are spreading, and we still have some folks that have decided not to get vaccinated yet. So let's go back to that message.
Yeah, so we have 54% of Jersey City having had one or more shots, so fully vaccinated, 54%. We have an additional 12, 13, 14%. 14% who have had at least their first shot. So if that's a Pfizer or Moderna. We are now following up with them as we continue to do mobile clinics. I think today or tomorrow we're at Goya. We just went to Reliable Paper. We're hitting all of the warehouses as well because we know that people are going back to work. We're in different communities. Today we're at Our Lady of Mercy. And any community group that has a network that wants to invite us, we go. We bring Moderna and J&J on site. Pfizer's a bit more complicated because you have to mix it with, Then we have Tuesday through Saturday. We're doing mobile sites. Monday through Friday, we're doing sort of like standard locations. We're still up in the Heights. We still have a location in Greenville. We've got a location downtown and 2 locations in the Heights, more or less. Up the hill and then the Heights.
And yet you still meet residents, as easy as you've made it for COVID vaccines, you still meet residents say, I'm not getting that shot in my arm.
Well, there's a lot of fear. We've created a lot of fear. The media creates fear. There's some people's religions don't believe in it. There's some people's political beliefs. And so combating all of that, of what people are accustomed to or acculturated with, with their own customs in their community. These are things where we need to share the science, try to make a strong argument, but their personal beliefs really are what are upheld. And so we understand some people just, are adamantly against it, but we will say we're seeing right now the results of our work are showing us lower cases.
That's great. And what about masks? Governor Murphy has lifted mask mandates, though there still seems to be confusion. Should we be wearing masks? Should we not be wearing masks? What do you suggest?
At the city, it was hard to work in masks. If you're vaccinated and you're working in the office place, you don't have to wear a mask. So we, offer pins to people that say I'm vaccinated if, they feel like it's important for you to know who you're around or who you're with. I think as long as people are really exercising the hand sanitation and covering their mouths when they cough or really staying home when they're sick.
Yeah.
Some people still don't do that.
Right.
Some people really are workaholics. I have staff that have perfect attendance. And I will say that, if you're not feeling well, really think of not just yourself, but others.
Right.
If you don't wash your hands as often as you should, keep some hand sanitizer in your bag, in your car, somewhere where every time you touch something, know that many other people have been there before, and others will go after.
These are all basic hygiene rules that most of us probably learned in kindergarten.
I go back to that, like everything you should know in life, you learned in kindergarten, whatever that tome is.
Yep.
It is really a public health and hygiene, story. And sometimes you're just moving so fast. We're in a culture that's moving so fast. And we're also trying to catch up. We all feel like, there's so much that we've missed the last few months. So in our movement of like grabbing a drink, grabbing that coffee, going to get that sandwich, we just don't think as much as
grab the hand sanitizer, keep the mask handy just in case.
I have masks all over my house.
Absolutely.
I've got this hanging mask, and we've got all in my car, extra masks for others. I think, when I go into stores, I wear a mask. When I'm outside, I'm not wearing a mask.
At the same time, being mindful of other people's opinions about all this. Stacy, before we wrap up this segment, you came into the job in 2013. Obviously, none of us could have ever imagined.
Yeah, tomorrow will be the mayor's 8th year.
And you came in with the mayor, right? So what's the greatest lesson you've learned from when COVID started to now about public health and about how we can deliver these services?
So I come to the table not with a degree in public health, but have worked around poverty alleviation, and public health programming. So I think I learned that, everything is health. So we practice a health and all policy approach to the work we're doing in Jersey City.
And that's great. Stacy, when we come back, I want to hit on everything else your department is doing, because there's so much more than just COVID-19. There's support for the senior citizen community, the LGBTQ community. You've just put out a huge announcement of what you're doing for the migrant community. And we're going to try to touch on that in 12 more minutes over 2 segments. Thank you so much for being with us today.
A brand new truck isn't just a brand new truck. When it's tough enough to have best-in-class available payload and smart enough to know that a cab can also be an office. A truck equipped with best-in-class available towing that asks, why can't all that power more than just this truck? No, your brand new truck isn't just a brand new truck when it's the all-new F-150. Tough this smart can only be called F-150.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer a Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Hi, and welcome back to our 3rd segment of Tapped into Hudson. We're joined today by Stacy Flanagan, the Director of Health and Human Services for the City of Jersey City. And of course, we've had an extensive conversation about COVID-19, but I want to touch on some of the other very important issues that you guys deal with. And I think the first place I want to start, because you started to touch on it before, some of the human services. Homelessness is something you've done an incredible amount of work on, and something that's fascinated me over the past year, and I've seen this in some other cities, these mobile showers that you've taken out to the homeless.
Yeah, this started in late I'm going to say 2019. We were talking to some community groups, primarily in Journal Square, talking about the issues in the homeless community, and majority of it was, hygiene and support. So I really pulled from like former work that I did, I'm going to say like 20-something years ago. I worked at the Covenant House.
Okay.
And we would drive around New York City, not me, but an outreach team, and really just invite homeless in for a shower and something to eat. And it really did make a change. And while we didn't have all the resources, we started with a mobile shower unit that we had from our experiences from Sandy. So after Sandy and after a few large fires in Jersey City, the Office of Emergency Management got support to buy this unit. We rolled it into Journal Square, right behind the Lowe's, garnered some support from the community, offered, socks from our partner, Bone Bus.
Yep.
We got sandwiches or food from around the community. We opened accounts with the local providers so that when they saw homeless people, they also would be a little bit more open to their needs.
Right.
So we would give out Dunkin' cards or get them some new clothes at C.H. Martin. Really wanted to support what was going on at the square. When COVID started, we increased our time at the showers. And so we started, like early in the morning, so early morning showers, 8 to 11. And that was really because we saw people coming from the warming centers in Kearney that's run, primarily by partners of the county and the county's coalition to do that work. And then COVID hit, and we increased our days of shower service all the way to a point we now have a state grant to serve vulnerable populations, and we are open 7 days a week. In the middle of COVID, we saw that not just Journal Square was experiencing this, not that we didn't already know that, but greater need in other parts of the community. And we looked at a program that was happening in India, in Pune. And they provide bathroom services for women who often don't have those services. On buses run by women, and it's a social entrepreneur project. That was, maybe that's the vision to come in the future, but in the interim, we worked with that toilet board, the World Economic Forum, RB, the makers of our Lysol that we use throughout COVID, and we retrofitted 2 school buses. We have 2 showers, a bathroom, a hand washing sink, a laundry unit, an area for counseling or support services. We're just putting in a refrigerator. So now we're working with our local restaurants through an NJEDA grant called Sustain and Serve.
Yep.
And we provide meals, to different community groups across the city. So we're also providing meals to our homeless through that project.
Stacy, everything you're talking about, I mean, this is this whole person approach to helping Jersey City, right? And I think we all fall victim, right? It's so easy for us to drive through Journal Square, drive through whatever part of Jersey City or any other community, see the homeless people, kind of look, cast a side eye sort of thing. But in Jersey City, I think you and Mayor Fulop and the team, you're looking at it, you provide that shower, you provide that warm meal or cold water, whatever it might be, as a way of returning some human dignity to them, right? And that's really what
for
it's
us,
about.
it was really about the dignity and the self-confidence. There's many other community groups that are doing this, and we honor them, and we want to support them, because we aren't there late at night. We are not there in the overnights. And there's a tremendous number of groups out there that are doing this work. But what we were trying to do is build trust in government, so that we can help someone get to the next tier, which is going down to 514 Newark, right? Where we're now making an investment to support that one-stop shop for other housing resources and support. So we're, cleaning up a really tight space there so that it's COVID supportive, They can see clients, and we can get more people housed as we wait for the next iteration of funding.
And as we've dealt with the economic fallout of COVID-19, I think a lot of people, including Rebecca Symes, who joined us last week from the Waterfront Project, will predict that some of these human issues that we're dealing with, these financial issues, aren't going to get better right away. They're going to continue on for many months to come. And I assume this is something the Mayor Fulop administration is thinking about, and it's something we're going to talk about in the next segment. Thank you so much for joining us. We're going to be back for one more segment with Stacy Flanagan.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
Tapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintoproperties.com. Tapinto Properties, building Jersey City for everyone.
Cutting-edge surgical care is right here in Secaucus.
Robotic surgery is safer.
Shorter hospital stays.
Smaller abdominal incisions, the size of an M&M. Here at Hudson Regional, we provide world-class robotic surgical care.
Hi, and welcome back. We're going to jump right back into the conversation with Stacy. You know, Stacy, something we've reported on a lot over the past couple months and since we launched on April 1st and have followed Mayor Fulop for many years and the administration is this idea of Jersey City being a welcoming city. And that means welcoming to everyone, refugees, undocumented, whoever it may be. If you're here, and this is your home. And just a few weeks ago, we announced a grant or a new program. I guess it was a new program you guys launched, which provides some legal services to some of the refugees. Tell us about that.
So there's so many things. 3 years ago, the council passed an ordinance to bring immigrant affairs, which was then welcoming communities, into Health and Human Services, because we really were, justifying that whole human approach. And we created this division of immigrant affairs, which, heightens the ability to, within the government system, for more grants or a mainstay in the government, if you will. And we brought on a team of people. So we've got Spanish speakers, Arabic speakers, and we created a fellowship program. Through that fellowship program, we realized that we really wanted to get an accreditation from the Department of Justice. Our staff got trained from, the clinic, which is the Catholic law program that supports this. And late last year, we received our accreditation. We're the first municipality in the country to get that. So it enabled us to offer more real-time supportive legal services to immigrants transitioning status. As they transition status, there's a lot of expenses. So if we can do it free, we'll do it. If their work is complicated and they need an actual lawyer, then we would refer to our partners across Jersey City and the county. We then realized that some of the cost, including medical reviews of each individual to get them through their transition of status, required a lot more funding than many families had. So we applied, we had our medical doctor, Dr. Orlando Gonzalez, apply for civil surgeon status. It was a long road. He was granted civil servant status about a month ago, and we're doing our first civil surgeon review of medical support for family. I believe it's within the next 2 weeks, so that they can present to the transition support.
Stacy, we often get on the flip side of this argument, we get responses and comments on Facebook, and I'm sure you hear it, and I know Mayor Fulop hears it. They're illegal. Why are we dealing with them? Why are we providing these services? And I know that's a tough thing to take on. But
so I'd beg to say, the term illegal is not used in our language, but these individuals
shouldn't be used. It's too often used, though, isn't it? Yeah.
People are either undocumented or quasi-documented or here as a refugee because our country invited them here for their own protection. And oftentimes we work with more refugees who have full status. And these are individuals that want to become citizens. So we're serving people, particularly the civil surgeon program, we're serving people that want to become U.S. citizens and are studying to become U.S. citizens, are embracing their families to embark in this, naming the United States their country. And I think that's really powerful and really important to note. Like, these are people that want to pay taxes, that want to be a part of this society. And one person we helped with citizenship last year ran for county committee this year. In fact, again, and we were really excited to hear from someone saying, I wanted so bad to be a part of your democracy.
They want to be part of the democratic process,
and so like they had become a citizen, and years later they're ready to share their voice and be a part of the beautiful culture that is Jersey City. And so what we're doing is we're helping more people become citizens because it's something that they've, really fought for. These people are really fighting for their rights, and this is part of their rights.
Stacy, when it comes to Health and Human Services, obviously there's an election coming up in November. Mayor Fulop, of course, has announced he's running for re-election. He does have an opponent. But if Mayor Fulop gets reelected and gets what he wants, where do you see the Department of Health and Human Services and some of these programs going in the next 4 years?
Well, I believe if Mayor Fulop gets reelected, and I hope he does, he's been a wonderful boss, and he's really thoughtful and progressive. I think we're just going to continue doing some of this work and advance that work with more support for the community. I mean, I think every time we look at dollars that we have, we're just reallocating funding to spend more on the residents and what the residents need and how we can better serve them.
Stacy, before we wrap it up here today, why don't you tell the residents one more time, where do they go to get their COVID vaccine? Where do they go to find out how to make a healthier JC?
Yeah, so we have our healthierjc.com website, and that's not just us, but it's all places for health around the city, and jcnj.org/vaccine. You can find out where we are any day of the week and how you can get a vaccine.
Perfect. Stacy, you've been a perfect guest. You wrap it up right on the button for us. Thank you so much. As we say every week, stay safe, stay healthy. If you haven't gotten the COVID vaccine yet, I hope you'll consider doing it so we can get out of this mess as soon as possible. Thank you.